Dr. Julian Wichmann, today you had a lecture here in Ljubljana. You're a medical doctor. We had a conference organized by Research Nature Institute. If you could shortly introduce yourself, how did you get interested in cannabis field?
Sure. So I'm originally a medical doctor and I was a radiologist. So I did CT, MRI, X-ray, etc. At the hospital, but I was also doing night calls and at the house patient visits. So a pain patient at 4 a.m. in the morning and you're the general doctor for them. And over time I got more and more interested in leaving the hospital system, working more also in maybe digital health, telemedicine, so being able to provide for more patients. And then actually a little bit coincidentally I stumbled onto the research into medical cannabis that basically said this can be a very effective medication, and there was a German law that allowed doctors to prescribe cannabis. And so I actually ended up building a company together with some colleagues that is now the largest, actually the largest medical European provider for cannabis treatments in Europe. We now care through Algea Care, that's the name of the company, for more than 11,000 patients.
Were patients also asking for cannabis treatments?
Yeah, so the situation in Germany was that there was a law passed in March 2017 that said from now on, in theory, any doctor could treat patients with cannabis. And we started working on the company in 2019, 2020, and what we saw was there was no doctor visible. Patients were asking patients and friends, hey, I've heard about cannabis as a medication, but I cannot find a doctor. Do you know anyone? And our approach was to be very visible, so that's why we have very active website, social media, Instagram, TikTok, etc., where we also educate and educate Germany and also other countries that, hey, cannabis is available as a medication and it can be very effective and very safe, and it's maybe something that you should consider when other medications don't work for your disease or symptoms.
So what are your experiences with cannabis treatments? Could you describe perhaps a case with a patient that you remember most?
Yeah, so overall very positive, and that's also the general data coming out of Germany, where more than 75% of patients say, hey, this is working for me, or I also have a better quality of life. So for us it's pretty much standard. Patients have a follow-up every 4 to 6 weeks, and we routinely see that at the first follow-up, patients say, I'm doing much better, I'm doing better than I've done for health-wise in the last decade. There's many cases. I think what we hear very often that we also keep with us is patients saying, thanks to cannabis and cannabis treatment through Algea Care, I'm back at university, I'm back in my job, I can work again, which I couldn't before. We've also heard people actually canceling their divorce. So I think as a doctor it's easy to underestimate the impact that it has on people's lives when you have chronic symptoms and you feel it every day. One medical case that I want to highlight is a patient with multiple sclerosis that told us that she had, prior to cannabis, actually loss of vision partially, so she wasn't seeing fully, and she had pain and also discomfort in her face from the nerves not working properly. And she tried all the other medications, and also doctors told her there was really no other option that we can do except for steroids. And when she tried medical cannabis treatment, and I was personally surprised actually, that not only were the discomfort, the pain was gone, but also the loss of vision was reduced, so she could really go back to work.
What kind of products are available to prescribe?
So in Germany it's pretty wide open. Majority is flowers, then there's extracts, so liquids. There's also, coming from the pharmaceutical industry, readily made products like Sativex, etc. I think in general, if you need an easy solution from a doctor's perspective where there's just one, and also if the patient needs an easy solution with not too much hassle, then extracts make more sense. But from a medical perspective, if you want to access the full potential and really dig into it and become an expert, so to speak, then I think flowers give you more variability. For example, what we see very often are patients that through Algea Care are prescribed 3 different strains, a different cannabis strain in the morning, a different one in the evening, one for peaks of symptoms, etc. And I think there you get even better treatment response, but obviously it's more complicated. So I think it depends on the doctor, the disease, and also the patient and like the surrounding life circumstances.
Is Germany cultivating cannabis for medical purposes itself?
It is already. There's a few companies, but obviously, I mean, they had to build up the knowledge. So I think the product that's coming from outside of Germany is still superior to the German product, and also the quantity is way too small. So it could only, be used for a fraction of the demand already. So still in Germany, the majority of product comes from Canada, Portugal, Scandinavian countries, and I think now more and more also South of America.
Is it regulated differently than other medicine?
Yeah, it's a little bit different. So you need to have a patient with a chronic disease. It needs also be a severe disease. So I think documentation is very important. It's important that you document what did this patient do before, what other types of treatments and medications has he or she tried out, because those need to be exhausted. And then you need to see that, hey, this could work in this patient. So I think as a doctor it's very important to document consistently and also a lot. So you also see when you look at the case later on, hey, did this work for the patient? Other than that, cannabis is controlled as of now a narcotic in Germany, so it's a narcotic prescription, different to normal prescriptions. These are personalized prescriptions that the doctor has to apply for, etc. And that's only the prescription part. A separate part is the reimbursement part, the road to statutory, so from the state, health insurance reimbursement is complicated. You need to apply for it. It can be rejected. It's rejected often, and there's a high barrier there, and that's why a large portion of patients in Germany are either privately insured who get cannabis or are self-payers, and that's good because what we're seeing now is that the prices are going down. So cannabis at a pharmacy is starting to become, although it's much better quality obviously and controlled, it's starting to be priced at the same price as cannabis as a black market drug. So I think there's even less reasons when you have a medical condition and you're trying to treat yourself to go to a black market and instead go to a cannabis doctor, and in the end probably pay the same, and there's no other information shared with your insurance.
How many doctors is prescribing cannabis products?
We don't know. There's a lot of lack of data in Germany. Our assumption is that about 2% of doctors, that would mean a few 10,000s, have ever treated a patient with cannabis. We personally have now about 90 doctors and we care for 11,000 patients. So if you look at that number, we should see more growth and more patients getting access, but it's still very hard to find a doctor that's going to prescribe you cannabis in Germany to this day, unfortunately.
Do you think cannabis is still stigmatized in health
Absolutely.
care
It's
system?
still highly stigmatized, and that's why we do a lot of also press coverage to educate the public. And interestingly, like when we talk to the press, there's a lot of jokes sometimes coming, although we're talking about a serious topic, talking about cannabis as a medication and the people that could benefit from it. And we heard way too often that patients go to some doctor, try to talk about this topic because they read about it online, and then they get not only rejected but maybe even cursed out and are forced to leave the practice. And I think the destigmatization of cannabis needs to happen in the public first, needs to happen with patients, but it definitely also has to happen with doctors.
Why different strains are so important?
Yeah, I think there is no one size fits all in cannabis, which is the beauty but also challenge of it. And so for example, if you're a pain patient and you have a sleeping disorder, then you need a strain that's going to fight the pain primarily, starting in the morning but kind of throughout all day. But if you're also trying to, and that's also a side effect of cannabis and some strains, you want to create sleep, like you want to have the patient sleep better, get a little bit drowsy. That's something that you can use medically, although it's a side effect in the evening. There you would prescribe something that makes the patient more tired and brings them to sleep and improve sleep quality. In the morning, that wouldn't make any sense at all, and it would actually limit the quality of life. And so our experience is really 2 to 3 strains, but at a low dose works better than one single strain or product, and then if it doesn't work, go high in dose, because that leads to more and more side effects.
And how many strains you have available to prescribe?
In German pharmacies, you have more than 100. Current status is more than 120 strains are usually available, and I want to say 20, 30 different extracts, and I think that's a challenge. And I think for doctors, the challenge is more often not how do you treat your first cannabis patient, but what do you do differently after 100 patients, or when the patient has been treated by you by more than a year, because we are seeing that frequent follow-ups and a modification of the treatment is the way to have the safest drug and best treatment response.
Do doctors have opportunity to get educated on such?
So there's no official specialty or course that you can take, which tells you a lot about how stigmatized cannabis is still in the medical community. We decided to do it ourselves. So what we did internally, we read all the books. We have a research division. We are continuously reading all the research, and we started doing internal educations, also especially based on data. I think it's different when you look at only a handful of cases and individual stories versus when you look at thousands of cases and you try to kind of blur out the white noise and figure out what does work for the majority of patients. So we do it internally. I see that also from the industry there's more and more webinars and conferences, but I think still it's very much focused on your first patient versus 100 plus patient, and I think that makes a difference in your skills also as a doctor, how you treat these patients.
What would you say about your cooperation with Research Nature Institute, and why do you think such seminars and conferences are important?
Yeah, so I mean, Bojida is really representing the institute and also the faculty internationally. I met him at a ICBC meeting in Berlin where we talked initially about research. So I think it's good to be very visible, and I think Slovenia and also as a country has a chance there. And I think research is actually the way. So when you start to collaborate on research projects, I think then you destigmatize, you create more scientific evidence, and that's the way how you bring medical cannabis, I think, into clinicians' hands, into doctors' hands. So looking forward to more collaborations there.
Okay, thank you very much.
Thank you.